Good afternoon, and thank you for joining us on what is a beautiful fall day through most of Idaho, I believe, other than a few fires. We appreciate you joining us for our new seminar that's being offered this year. Can We Talk About Falls is designed to kind of help us through what can be one of the most difficult discussions we have to have with loved ones and spouses and parents. This also happens to be the last seminar for this year's campaign, but it is a good one to finish up on, so we're very glad that you are here with us. Next slide, please. My name is Erin Olson. Sometimes I forget that I need to introduce myself. I work with the Idaho Commission on Aging, am a program specialist, and am proud to facilitate the Falls Prevention Awareness Month campaign throughout the month of September, and this year a little bit into October, just because we had a lot of information we wanted to share. We are able to do this because there is funding through the Older Americans Act that is administered by the Administration for Community Living. And we also are coordinating with the National Council on Aging. And I won't give you all of those acronyms because they just all start to run together, I know. But the Idaho Commission on Aging is the state unit on aging for Idaho. And the Falls Prevention Coalition of Idaho is one of the programs that I founded and I'm very happy to be managing, and is enabling us to kind of expand what we do for falls prevention a month. We are very eager to share strategies with you today that are going to enable you to have discussions with others about falls risk and falls prevention. Our goal is to support maintenance of overall health and well-being, not only for you, but also for people that you may be caring for. Next slide, please. So everybody always wants to know, can we get a copy of the slides? And of course, the answer is yes. If you can find the resources button on your Zoom toolbar, you can give that a click. It will open a panel on the right side of your screen. And there's an option, and I apologize, I'm not sure if it's a tab or a link, but it's called Documents. And in there should be 3 documents. One is a copy of the slides. The other 2 are copies of the kind of handbook, if you will, that's been put out by ACL and the National Council on Aging to help people have good conversations about falls. One is in English and one is in Spanish. If you click on the links for those documents, they will download to your downloads folder and you have them. If for some reason that doesn't work, no fear. I will say not today, but by tomorrow, I will have those added to our normal website where you can go in and download them. And that is www.aging.idaho.gov/falls, FALLS. And I will be giving you that address a couple more times, so don't worry if you didn't quite get it this time. Next slide, please. We are recording this seminar, as you heard, so you can have access to it after this presentation is over. Please do feel free to share the link with other people. We want to get this information out to anybody that wants it or needs it. You will receive that link from Zoom, so look for it from Zoom Events pretty much as soon as it's over. They're very quick about getting that initial copy available. It will also be available in a few days on our YouTube Falls Prevention channel website. It's youtube.com, and then our handle is at IdahoCOM. So Idaho spelled out, and then the letter COM, which simply stands for Commission on Aging. Idaho COM is not only the YouTube handle that you can use, but it's also the one for Facebook and all of those other social media outlets. So please do look for the recording, review it as often as you need, and share it. Next slide, please. When you think of a question, and hopefully you will think of at least a few, please use the questions panel that is also available from your Zoom toolbar. Normally it's right about the middle, but again, don't hold me to that because everybody's devices are different. Put your question in there. When we get to the end of our experts presentation, we will have our Zoombie, who happens to be David Thompson, the director of our South Idaho Area Agency on Aging out of the Twin Falls area. He will be posing those questions and we'll try to get those answered for you, time permitting, of course. Next slide, please. It is such a beautiful day that I'm sure absolutely nothing can go wrong, right? Well, except that we're dealing with technology. And since this entire presentation relies on technology, and you are where you are, and the three of us that are presenting are all in different places, stuff happens, as we like to say. Don't want it to happen, but that's what we say. So if you have any kind of issues, especially if your audio gets jittery or something like that and it doesn't seem to resolve, log out and log in again. Don't ask me why, but sometimes that resolves that situation. If I or our expert get disconnected, we will reconnect as soon as possible. If it's our expert, then I will try to cover a little bit until she gets back on. If they lose me, then she'll just go on and talk without me because you don't need me for that anyway. If we lose power or something like that, if we have solar flares that bring down the entire internet in our hemisphere, of course, we'll reschedule and we will communicate with you via email about when that will happen. But we're going to start putting out positive vibes for the rest of our time together and hope that we do not have any technical difficulties. Next slide, please. So what are we going to talk about? People always like to know, what are we kind of waiting for? What's the order going to be in? We're going to start off with understanding falls and why falls matter. I will be talking with you about that. Then we're going to go to our expert, Julie, who's going to talk about kind of clarifying the caregiver role, identifying the risk factors for falls, how to facilitate effective communication with others. And then, as I said, time permitting, we will answer as many questions as possible. Next slide, please. So now we get to the content. Got through the logistics. Now we get to the better stuff. Julie's going to give you the best stuff, but I'll give you some better stuff. In order to learn about how to talk about falls, first we need to know what a fall is and why we should even be talking about falls. So let's go to our next slide, please, and get to my favorite question. Because people get a really funny look when I ask them if they can define what a fall is. To many of us, it seems obvious. We know what a fall is when we see it. But it's important, especially when talking with others about their own falls, to be sure that we're kind of on the same page, if you will, and that we all know what we're referring to. So for our purposes, here we go. A fall is unintentionally moving downward, usually pretty quickly and freely, kind of that pinwheeling arms kind of thing, without control. That's important. From a higher to a lower level. So a fall isn't planned. Of course, we don't plan to fall. I think that's illegal if you do that, but we don't plan to fall. In some way, we move downward from a higher to a lower place. And we do so without being in full control of our body and how it's moving. We all get that. Now, this is important because we do not need to fall to the floor for it to be considered a fall. It's from a higher place to a lower place. So we can fall onto a chair, we can fall into a wall. There are lots of things that can happen. It still counts as a fall, even if you don't go all the way to the floor. This is really important because most adults, especially older adults, will not admit if they have fallen. First of all, it's because we're often embarrassed about falling. But secondly, especially with those older adults, we worry that people will think we're fragile. They'll want us to stop doing things we like to do, and possibly even think we need to be moved to some type of assisted living or care facility. That's why less than half of older adults who fall ever admit that they've fallen. Even if they had an injury, they still don't tell their family members or their doctor. Because we need to be able to communicate clearly about falls and falling, we need a clear definition. And that's what we now have in front of us. And of course, that slide will be in your handout when you get that downloaded as well, so you can refer back to it. By the way, I do want to mention that it does not count as a fall if the person had loss of consciousness, they fainted, they had seizures, or some type of overwhelming trauma. That's just not considered a fall. It's a different medical condition. So let's go to the next slide, please. So now that we know what a fall is, the question becomes, why do they matter? Why should we care about falls at all? Well, we can't possibly go through all of those reasons, but just a few of those include that, falls are the number one cause of accidental injury and death in older adults, which we are calling people over age, 60 to 65. It's also the number one cause of traumatic brain injury. We often think about hip fractures, which are very common in older people, but it's actually the most common cause of traumatic brain injuries in all age groups, not just older adults. So in Idaho, because we like to talk about Idaho, 1 in 3 older adult Idahoans fall at least once each year. Many of them fall more than that. And if you live in Bannock, Bingham, Bonneville, Elmore, Jerome, Kootenai, Shoshone, or Twin Falls counties, you actually live in places where the fall rate is at least 5% higher than the entire rest of the state. So, there's a whole technical debate about why that is, but just know that it is a fact. It's also interesting to know that Idahoans fall 67% at home. Most of us know that we're more likely to fall at home, usually in bathrooms, but secondly, in kitchens and in living rooms and on stairs, of course. But 67% of our falls happen at home, which is kind of good news because we can start to take control of that environment to make it safer. There's about 9% that happen in institutions or buildings, and about 4.5% in public spaces. So we do want to make sure our public spaces are safe as well, but not nearly as many as happen in our home. 1 out of 5 falls, or 20%, causes a serious injury, those broken bones or traumatic brain injuries that we were talking about. And nationwide, more than 950,000 people are hospitalized because of a fall. That's almost 1 million people, and I just happen to think that's far too many. Once we fall, we are more than twice likely to fall again. So it's not something that happens once. Once the fall happens, it tends to happen again. So if we care for an older person, these certainly apply to them. If you and I, are an older person, it applies to us. And if we're an older person caring for another older person, then of course that is exponentially important, which hopefully is why you all are here. Julie's going to give us some good information about some of the ways that caregivers are impacted. Just know that a lot of caregivers said that they had to alter their routine to care for somebody who had fallen, and many of them were concerned, and it impacted their health by caring for a person who had fallen or by falling themselves as a caregiver. Next slide, please. Since 1 in 5 results in serious injuries, and many of those result in a hospital admission, I thought it might be important to know what happens after a person is hospitalized due to a fall. 33% were able to go home without assistance. Yay, that's good, right? A third, 33% go home, not as if nothing happened, but they can live independently. That may sound good, but what it really leaves us with is another 6% were discharged home, but they needed some kind of assistance. Unfortunately, over 1/2 were discharged to a skilled nursing facility or long-term care, and 5% ended up going to inpatient rehab. Now, that initial 33 or 1/3 doesn't sound quite so good. It's still good news for them, but not for the other 2/3 who weren't able to go home without any assistance. Unfortunately, there's a little more, I'd rather, bad news, and I'm not usually the bearer of bad news, but of those that were hospitalized for a fall within a year, following up after a year, 44.6% were readmitted. Well, to me, that's close enough to 45%, which is close enough to 50, that we got to say basically half of the people ended up being readmitted to some kind of a facility. Unfortunately, as well, like about a third, 33%, die, and they die early. That's not just due to normal aging. And again, that's a whole different study and topic. But now I hope we can see why falls matter and why preventing them is absolutely the best solution. Let's go to our next slide, please. So I have just a couple more visuals to help us understand the importance of falls and falls prevention. When it comes to the frequency of falls, and I just think this is a great graphic, every second an older adult falls. This equates to 36 million falls. Of course, this is nationally. 8 million injuries, 3 million emergency department or emergency room visits, 950,000 hospitalizations, like I mentioned before, and 32,000 deaths each year because of falls. Next slide, please. Let that one sink in for just a minute. And this is kind of the last data that I'll give you. Falls also impact our infrastructure. We don't like to say, it's burdensome, but it does impact our infrastructure. In 2018, the US had an older population of about 52 million people. They experienced 36 million falls and had 8 million injuries. It's projected that by 2030, which, believe it or not, is only 6 years and a couple of months from now, we're going to have about 73 million older people, which at current rates will experience 52 million falls and 12 million injuries. So as we struggle, among other things, about how to fix our healthcare system and the shortage of emergency medical responders that we have, let's remember that all of this is we can help it by preventing falls, by not even bringing falls into the picture and freeing up those resources to deal with, I don't want to say true medical emergencies, because as we said, falls are, but falls are also preventable. So let's see if we can take that on. Next slide, please. Julie's going to talk a little bit more about why falls happen. So I'm not going to talk a lot about what's on this slide. There's usually more than one cause. It's called multifactorial. It's usually the person plus the situation, what the person does, how they do it, how their body behaves or reacts or doesn't behave or react, and possibly environmental factors. There are physical factors associated with aging that also commonly increase falls risk that we're going to be talking about. Next slide, please. So again, we're not going to go through all of these now because I'm going to leave it up to Julie, but there are what we call intrinsic and extrinsic risk factors. Intrinsic means it's inside of us. Extrinsic means they are external or outside of us. We generally can't change, or at least not completely remove, intrinsic factors, but there are things that we can do to help. For example, if our balance is off because of aging or because of a chronic condition, we can do exercises to help us improve our balance. When they are extrinsic, those are things that we can often modify. If we're taking medications that make us dizzy when we stand up, we might be able to take a different medication. So all of these are something that we hopefully can do about if we identify them, but we can't always remove them, but we sometimes can make some different choices. Next slide, please. To simplify understanding the discussion and taking action to reduce falls, the Falls Coalition, or FPCID, created 4 pillars of falls prevention. They include nutritional health, physical health, emotional health, and environmental safety. Let's go ahead and move to our next slide, please. Because for my last few minutes, I want to talk a little bit about the emotional health factor, which of course Julie is going to touch on as well. We have all become more aware of the importance of addressing our emotional and behavioral health. Thank you, COVID, for that. Let's go to the next slide. Because when it comes to falls, it's important. After a person falls, many things happen. First of all, they can have concerns about doing activities that require walking or mobility, things like bathing, where there's those hard and slippery surfaces. They don't want to fall. It can be about meal preparation that might require bending and reaching. Again, floors can be sometimes slippery. And the same is true for doing laundry and housework. They often reduce or stop doing these things, especially if they live alone and there's nobody there to do it for them. And you can start to see how this becomes a problem. Likewise, they might also limit activities that are new, take them outside the home or are physical. They might lose interest in social activities because they know that the environments and the people around them aren't controlled, and they have a fear of falling in those environments where they don't know what they're going to be like and they can't control them very much. So let's go to our next slide. And we will talk about the last slide that I have, which is the fear of falling, which we just mentioned. We also have something called the fall cycle. In short, the fall cycle means that after a person has a fall, they often have a fear of falling again, which statistically is real. Remember, we said that once a person falls, they are more likely to fall again. They become less active. This reduces their muscle strength, mobility, balance. It can be a significant cause of falling again, and you can see how this cycle is just going to repeat itself. I almost wish it was called the falls funnel because it just spirals downward. Unfortunately, the person often experiences a variety of psychological and social impacts. They include that social isolation, like we talked about, which can lead to loneliness. They can become depressed. They get a diminished quality of life because they're not engaging in daily activities or with other people. Then they get a loss of independence because, again, they're isolating themselves. We get an increased rate of that early death that we talked about before. All of those are bad. So we need to be aware of this, all of this stuff, the fear of falling, the fall cycle, what causes it, so that we can be aware of it for ourselves as well as those we care for. Next slide, please. Now let's switch gears and talk about how we can talk with others about fall's risk and risk of falling. Next slide, please. Please help me in welcoming Julie Teresini. She has worked with older Idahoans for more than 20 years. I didn't ask her an exact number. She works with our Southwest Idaho Area Agency on Aging, or AAA. She specializes actually in working with caregivers as the Community Care Program Supervisor. So please welcome her, and Julie, take it away.
Hello, everyone. Thank you, Erin, for such a lovely introduction. Thank you all for being here today, for giving us all your time and your attendance at kind of a late hour in the day for everyone. So thank you for your time. I actually do not consider myself an expert. I just always say, you know, I have my career has involved working for Agency on Aging, working with seniors, working with caregivers, and being in that aging field. So I don't consider myself an expert, but what I am hoping today that all of us can gain from this discussion that we're going to have, because, you know, beforehand, I always get a little bit of nerves before I start speaking. So I thought, well, maybe I'll just look at it as myself, a conversation and a discussion that we're all going to have. I'm hoping that, you know, after this, you feel empowered wherever you are in life on this webinar, whether you're a caregiver, whether you're just an individual who's wanting to start a conversation with your physician about how we can talk about falls. I'm hoping that you feel empowered at the end of this, and you can have some little tips and tricks to keep in your toolbox for yourself. I did rely and lean heavily on the national, it is a mouthful, between Southwest Idaho Area 3 Agency on Aging, my last name Torazani, and this National Council on Aging Fall Prevention Conversation Guide. It is all a mouthful for myself to say. I did rely on that guide as some talking points as we move along through this discussion, and then just also some experience that I've had in this field. So next slide, please. So our learning objectives today are to learn the importance of fall prevention with the caregiver role, to help identify some risk factors. How do we start a conversation? To develop a plan of action, and some tips and tricks along the way. Next slide, please. So who is a caregiver? For the sake of this conversation and how this word is defined in this discussion that we're having, who is a caregiver is a family member, a friend, a neighbor, someone who provides unpaid assistance to another person who might have an illness, a disability, or just needs some assistance with some activities of daily living. A caregiver is that person's primary support person. So these are, this is geared towards not a home health aide that is coming from maybe a home care agency and might call themselves a caregiver, because they are a paid caregiver through a home care agency. In the realm of this discussion, a caregiver is these informal family members, friends, neighbors who are the primary support person for another person. And that other person we typically call a care receiver. So we have a caregiver, and usually we have a care receiver. The next slide, please. So I pulled together this combination of all these different photos to show all the different roles and relationships that we often have in life. Previously, where we're at right now in life, all of these are, relationships. This is all of us, right? And I cannot tell you how frequently I hear this saying, I'm not really a caregiver. I'm just the daughter who takes care of my mom because she's my mom and that's what I'm going to do. I'm not a caregiver. This is my husband. I'm going to take care of him. I help him with whatever he needs. I'm actually not his caregiver. And so often it's a challenge for us to self-identify that we are in this caregiver role, because as those two examples just showed, typically we're providing this care to someone who is absolutely one of the most important people in our lives. And they're oftentimes one of the most important people that we love the most. And it is often difficult for us to identify ourselves as these caregivers, this word caregiver. So I guess, I didn't add this part in, but I guess a call to action is that, when you're out and about, your friends, your families, I think we all need help. We need help with helping caregivers identify that they're a caregiver, and so that they will reach out and seek those supports and resources that could help them in that journey. Next slide, please. This is one of my favorite quotes. I work with caregivers. It is my passion. It is my role. I think the world of caregivers. So this is Rosalind Carter, her famous quote that we use frequently. There are 4 kinds of people in this world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. And I put that slide in there because, you know, I'm not sure who's all on this call, where they're coming from, what information you're looking for. But if you reread through it, you know, those who have been a caregiver. So if you've been a caregiver, and those who might be a current caregiver, those who may be a caregiver in the future, and then we're gonna have those who will need caregivers. Maybe as we age, we're going to need a caregiver. So hopefully with this conversation and this discussion, wherever you are on this, you can take away some tips and tricks. Next slide, please. So why is fall prevention important? So number one, falls are common. Erin just went through the stats and the details on that. Falls can cause serious injuries. Falls are costly, and falls impact caregivers too. So I struggled with the wording on number 4, falls impact caregivers too, because it's actually really hard to roll it off my tongue to say falls impact caregivers too. But I could not figure out another way to rephrase it. So I stuck with falls impact caregivers too, and thought I would just go ahead and give an example of where I've seen this impact on our caregivers. I also have to say that throughout this presentation, I'm actually leaning heavily on some just personal experience I've had. I have a plethora of examples I could have pulled from, and I kept coming back to 2 just really personal examples that I had regarding fall prevention, and especially this falls impact caregivers too. So I had a wonderful neighbor named Irene. She lived a couple of houses down from me. She was absolutely what I aspire to be when I am her age. She was absolutely so socially engaged. She was well known in our neighborhood. She gardened. She lived completely independently. You know, she did all of her own independent living. She went to the senior center for congregate meals. And my favorite thing that Irene did was she loved to go to the grocery stores once a week and just see what they had. You know, scope out their floral departments, look at what the sales were. She did not cook these elaborate meals. She just enjoyed going and browsing and seeing what new items were in. One day, unfortunately, Irene fell trying to get into her car and broke her leg. Why she fell, how she fell, don't know. Erin just went over it, just an accident. I couldn't explain how she fell to break this leg, but it completely affected Irene's habits and behaviors in that time frame. But the other impact it had was on her daughter, Lisa, because prior to that fall, Lisa, let's just say, was just her daughter, right? She was just coming over for that social interaction, bringing over the grandkids, having dinner, going out, doing fun things with mom. The Irene falling and breaking her leg thrust Lisa into a caregiver role that she was not anticipating, that she did not see coming. And I can just tell you for that couple of weeks while Irene was rehabbing, if you would have asked them, they would have said it was absolutely chaos for them. It affected, you know, not only Irene lost this whole social interaction that she was getting, because now she's only leaving the home to go to doctor's appointments, but Lisa now is trying to maintain 2 households because she moved in with Irene to help. She's trying to maintain 2 households. She has children. She was working, so she's missing work to help take care of Irene. And she's completely stressed and overwhelmed with what is occurring. So that's where I stuck with that falls impact caregivers too, because that is a great example of not only what the dynamics of what Irene struggled with that fall, but also what her daughter started to experience after that fall. Next slide, please. So research shows us that caregiving is a challenging role, that the toll of caregiving impacts a caregiver's health. Oftentimes, a caregiver will prioritize the care receiver's health over their own health. So caregiving impacts their health, and fall prevention for the caregiver or the person they're caring for can save time, stress, and money. Next slide, please. According to the guide, and research shows us that after a care receiver's first fall, caregivers report a significant increase in their caregiver burden, their fear of falling for themselves, and their fear of that their loved one will fall, and an increase in depression. And a caregiver's top concerns after that first fall is how to manage their own stress and how to keep their loved ones safe at home. And my whole team could attest to you across the board. Those are the caregiver's top concern of managing their own stress and how to keep their loved ones safe at home. Those are absolutely their top concerns. Next slide, please. And then 1 out of 5 caregivers report a high level of physical strain as a result of their caregiving duty. And 59% of caregivers report helping their loved one with at least one activity of daily living. When I did this presentation the last time, I was in person, so it was a little easier to ask this question than being on Zoom. But I was actually presenting to Fit and Fall instructors, and I asked them what the top activity of a daily living that a caregiver assists the most with. And our activities of daily living are assisting with eating, toileting, transferring, bathing or showering, and dressing. So those were your top activities of daily living. And I asked them, what they thought the top activity that caregivers report that they assist in. And some got it right and some, missed the mark a little bit. But the answer is transferring. So caregivers typically, that is the number one activity they assist with. Helping someone in and out of a chair, or in and out of bed, or in and out of a vehicle. And then where's the number one risk of falling is when you're transferring someone. And sometimes you're watching and you're holding your breath because you're thinking, I hope that both of you don't fall while you're trying to help someone get out of this chair, right? Next slide, please. Caregivers report, what do they want? What does the caregiver report that they want, in regards to fall prevention? So they were looking for options to increase their physical fitness. I especially always take this into consideration when you do have a caregiver who's providing that 24-hour, 7-day-a-week care. It is very difficult for them to leave the home. If they can leave the home, usually it is they're attending doctor's appointments, or there is a priority of what they're going to have to get done when they can leave the home. And a fit and fall class oftentimes does not make that priority list. So they are looking for what kind of options can increase their physical fitness. Is online an option? Is there an option to bring someone into their home? So what are some options that we can give them for physical fitness? They would like more information on caregiver topics, and they want to worry less and keep their loved ones safe, right? That's all of our worry and concern. And that care recipients are likely to be at risk of falls due to a chronic condition. Next slide, please. Now, I wasn't going to go into too many details with this because I knew Erin would do a great job in covering what is a fall and some of the risk factors. So the most common risk factors that can result in a fall are our physical risk factors, our behavioral risk factors, and our environmental risk factors. I would categorize Irene, going back to Irene, as falling into that behavioral risk factor. Those are the things that we do or don't do that increase our risk of fall. Irene successfully rehabbed from that broken leg. We had several weeks in there of rehab and getting her back to independence. after that fall, this behavioral risk factor really did play into a psychological impact with Irene. Her question became, I enjoy going to the grocery store and checking it out and seeing what's new. And there's this whole part of me that just loves to do that. However, that's how I fell trying to get into the car and broke my leg and went through this whole rehab. So is it worth my risk? Is it worth my risk to take that, in her eyes, unnecessary trip to the grocery store? Or that flip side of that is, but what do I give up? And that was absolute social engagement for her. So does she give up going to the grocery store because she's afraid of falling? Or is it, well, now I'm not getting out of the home, not interacting with others in my community, and I really enjoyed, looking around at this park. So, those were the risks that she weighed, behavioral, and we know that once you fall once, there is that psychological fear that you encounter. Next slide, please. So now we're getting into the crux of our discussion here. How do we have a conversation about falls? How do we have these conversations for ourselves? And how do we have a conversation with someone we love on fall prevention? So my first advice is you take it step by step. Everything takes step by step, and always look at all of this as a team effort. All of us, there are several of us, there are several others who absolutely want to assist people as much as possible to not fall, to have fall prevention, that we want someone to be able to stay in their environment as long as they are able to, that we want them in the environment that they choose to be in. So in starting these conversations, go step by step and always look at it as a team effort. So I tied 1 and 2 together on this. Is it time to talk about fall prevention? And if it is it time to start to talk to others about fall prevention? And then steps 3 and 4, I tied together in that when you're doing this, you want to develop an action plan, and you're going to want to take action steps to develop and work on that action plan. Next slide, please. Okay, starting a conversation. So I should have changed these and made what is the goal, the first one, and then educate yourself. So I'm going to kind of flip it a little and tie them together. So what's the goal of the conversation? And it doesn't have to be difficult. You don't have to overthink it, and you don't have to make it hard for yourself. What is the goal? I want to start a conversation about fall prevention. Just, keep it short and sweet. That's your goal. In order to reach that goal, I highly recommend that you educate yourself before you start a discussion with anyone on falls. Research, look around, ask others, contact agencies on aging, do online research, educate yourself about the topic you're going to want to bring up and discuss. Have a couple of ideas, have some things in your back pocket to pull out when you need to, when you're starting these conversations. If you're going to make a recommendation for someone, it's highly recommended that you also follow that recommendation. So for example, if I'm going to bring the discussion up with my mother, and I'm going to tell her, you should really do a fall risk assessment. It would be really lovely if maybe beforehand, there are a tremendous amount of fall risk assessments out there. Maybe I narrowed it down to a couple of fall risk assessments. And before I ask my mother to do it, I take the fall risk assessment myself so that I can explain to her and know what I'm asking her to do. So that's just one example. Same example would be if you have in your mind that you want to approach about seeing if there was a physical therapist that could come in and work with someone, I would highly recommend, checking if that is even a resource that's available to you. We are in Idaho. It is extremely rural. It is a great idea to say, oh, well, let's see if we can have a physical therapist come in and give you some therapy. Well, what if there is no physical therapist available in the area? So that is something that you don't want to bring it up and then set it up for failure, that there's not even a physical therapist available. So always educate and research yourself. Absolutely always go in as a team effort. Sometimes conversations, if you go in and I call it you fight them as an enemy instead of as someone that's on your team. You want someone to understand that you're on their team and you want to help them maintain whatever goal they're trying to reach. I was in a training a couple of months ago and they said, move from the prisoner warden role and move to a team coach player role. And I kind of thought about that with a physician because, a physician, I'm like, okay, so let's say I'm on a team. The physician's my coach, right? But in order for that coach to be successful, he has to have my buy-in as a player, right? He has to make sure I'm buying in to him as my coach and what the goal we're trying to reach is. Recognize this might be an ongoing conversation. This is tough. These topics are difficult, can be difficult conversations to bring up. So prepare yourself. I sometimes phrase it as prepare for the marathon, not the sprint. If it happens as a sprint, that's great. Sometimes the conversation is quick and everyone's in agreement and it's short. It rarely happens in my experience. It's an ongoing, continuous conversation that you have to prepare yourself for, and you have to be willing and there to be flexible and to, to stay on, the track you're trying to accomplish. Hold on, I'm sorry, I lost my train of thought on that. Mindset. Recognize this is an ongoing conversation, and then oftentimes you have to have, you yourself have to be in the right mindset as well to bring it up. It can be, if you're hungry and you want to start a conversation about falls and you're finding yourself that you're short-tempered because you're really hungry, that is probably not a great time to bring up this conversation with someone that you're going to try and get them to discuss this with their physician. So be mindful of also where you're at when you're bringing this topic up to someone. Goes back into this next one, which is be mindful and open to change. Oftentimes you'll go in with a great plan. You'll have this whole thing laid out in your mind on that you're going to start this discussion with your dad because you listened to this webinar and yes, I'm going to go have this discussion with my father. I would love for him to, look at a fall risk assessment. If you have this great plan in mind and you go start this conversation and dad's just had a very rotten, no good day. He's very annoyed because the pharmacy's called and messed up his prescription and he couldn't hear the doctor's office when they called, and then he tried to call him back and then he got the nurse's voicemail again and he's frustrated and he's ornery for the day. It's probably not a good time to bring up the conversation. So you have to be mindful of where you are and where that person is. And you have to be open to change, that you had this great plan in place, but maybe you have to table it for right now and come back to it later on because it's an ongoing conversation. And finally, it's not easy. Okay, these conversations can be challenging. It's not easy. It's topics such as, falls, anxiety, discussing with someone that maybe their activities are declining, that things that they used to be easy for them are now becoming more difficult. Those are hard topics to bring up. These are hard conversations to have with someone. Regardless of what your relationship is with that person, these topics can be difficult. So be mindful with your approach, and I'm kind of feel like I'm being a little bit negative here, but they're difficult conversations to have, but they're necessary conversations for you to have. They are necessary conversations for you to have. Next slide, please. So action steps and plans. This is actually universal, no matter if you're a caregiver, if you're just wanting to have starting a conversation with someone, whatever topic you're really wanting to discuss with someone. These are action steps and plans that you could implement in a variety of fields in your life. So enlist support. Enlist support in taking steps to stay safe. So Aaron mentioned at the top, and I was absolutely nodding my head in agreement. None of us actually think we're going to fall, right? None of us actually think we're going to fall and that this is going to happen to us. So that's why it's important that we start this conversation, and that, you start that conversation with your physician, and list the supports around you. As discussing this with your family, friends, neighbors, senior centers, your resources around you, the people that are around you that you can look to for guidance and advice to help you stay safe. In my line of work and in my program, I'm all in on caregivers. I give such kudos to caregivers. They teach me something all the time. They are very creative. They are very innovative. They come up with some phenomenal solutions on how to take care of their person. Lean on your peers. Enlist those supports to help you to know what's available and out there for yourself. Discuss health conditions. So, discuss those health conditions with your doctor, your family, your friends. Are you noticing that, like I said earlier, something that used to be easy is kind of getting a little bit harder for you to do? I tag pay attention and notice and notes all in together. So I think the one thing, oftentimes you yourself are your biggest advocate for, especially when you go to the doctor, you are your advocate. Oftentimes a caregiver is that care receiver's only advocate as well. So pay attention and notice changes, and maybe keep a record, right? I know we have paperwork and whatnot, but keep a record. It's that old saying, and I don't know if this is actually true anymore, but they always say that you only have 7 minutes with a doctor's time and attention. I think I still would agree that my experience has been I get about 7 minutes with my doctor, and then he's pushing me out the door. So, if you have a list, if you have some notes, if you are paying attention and keeping track and giving the physician or healthcare professional that in a nutshell, keeping in mind that you really only have 7 minutes with that person. And sometimes you only even have 7 seconds to capture their attention. So note taking is super important. Then talk and discuss, like I said, I've talked and discussed with your pharmacist, your physician. Safety check of your home, that is a recommendation. Oftentimes I see caregivers doing this. Dad, I watched the seminar, it was great. If we do maybe a safety check of the home, you have lived here, for 60+ years, we're all comfortable. Maybe we should go through and do a safety check of the home to make sure that there's not some fall and trip hazards that we could eliminate. Because we've lived in this home for so long, we don't even know, we're just so used to it. So it might be nice to go through this list to eliminate some of our fall risks that we're finding. And then finally, fall prevention programs. I kind of missed on some of the other webinars, but there are the Fit and Fall classes that go on around the state of Idaho. And then, of course, like I mentioned before, what other resources or whatever other programs could we use to help someone be active and address the fitness. So I'm going to end this today because I'm running a little late here on the time. Next slide, please, David. So I'm going to wrap it up with a very personal example of using those tools that I just went through with you in my own personal life. So this little cutie patootie here in this picture is actually my mother-in-law, Joyce Torresani. And Joyce is 88 years old, and she lives in this beautiful 125-plus-year-old home in Green Bay, Wisconsin, and she's lived there for 60-plus years. And I kept coming back to Joyce as an example because I, Julie Torresani, got unknown, duly elected to start these conversations with Joyce by my family. I did not know I was in this running to take on this role, but I got voted in by my family to start conversations with Joyce on certain topics. So thinking back, I was like, some of those first discussions I was having with Joyce revolved around falls, because the best environment still to this day for Joyce is to be in her home. It is her community, it is her friends, it is her neighbors. This is the best place for Joyce to be right now. And Joyce was a caregiver for my father-in-law for 5 years. My father-in-law had dementia, and that last 5 years was very intense caregiving. So educate yourself. So this is what I did. I got voted in to have these conversations with Joyce. And I thought, okay, my goal is, this house is 125 years old. I can tell you it is not, it has no home modifications. I know that there are some things that we could do to make it a little bit easier for both of them. So I wanted to start that conversation. And I was very concerned that they were living alone. And if Joyce fell and could not call 911, could not get up, that Bob no longer had the capacity to call 911. So what were we going to do if she fell and no one could call 911? So that was my goal, was to start those conversations. I did educate myself. I am in Idaho. She's in Green Bay, Wisconsin. I did some research beforehand, what's available. With my experience, I had 4 things in mind, but I did research and look for those resources to make sure I kind of had a game plan before I started the conversation. On all of this, you approach it as a team. Joyce, I want you to stay in this home as long as possible. I want you to continue in this caregiver role. I'm on your side. What can we do to help make this work? Ongoing. This took me years. This was not a sprint. This was years of her and I having these conversations, looking at these changes. And it was absolutely a marathon. And it still is, because my father-in-law passed away 2 years ago. Joyce lives alone, for the last 2 years. So she and I still have these ongoing conversations with each other about what the needs are. Be mindful and open to change. I said there were some days I would call her and I found this great resource and I really wanted to start the conversation with her and get it in place and get it going. And, you would call, and it had not been a great day for her in that caregiver role. So be mindful of that. And it's not easy. It is not easy. Family dynamics, it's not easy. But, it's important that you use those tools that you have and start that conversation. So we're a little getting very close to going over time here. So David, next slide. Erin was kind enough to let me just give a brief blurb on the Idaho Community Care Program. I am the Community Care Program Supervisor. The mission of the Idaho Community Care Program is to support caregivers with people taking care of someone with memory loss, Alzheimer's, dementia, a memory concern. Our goal and mission is to help ensure that highest quality of life as possible at home. We do this service through what we call caregiver case management. We meet with our caregivers and do an assessment and help create an action plan and take some action steps so that they can continue on with this caregiver journey. We provide advocacy, for caregivers and to help caregivers advocate for themselves. Respite, we highly encourage every caregiver to take a break. Everyone needs a break from this caregiver role. And education, connecting caregivers with any type of educational opportunity, support group, anything that would help them to continue on with their caregiver journey. This program is statewide throughout the state of Idaho. Next slide, please. Finally, to contact us, Erin, I knew Erin would be sending this out. This is actually the main contact for the Idaho Community Care Program. It's manned Monday through Friday, 8 to 5. I wanted to put this number on instead of my personal email address because I knew that all the emails come into this, and if you're emailing me specifically, someone will get that email to me. So that is the main contact information. And that is it. So
That is it. Thank you so much, Julie. We appreciate it. Just everything that she said. Normally I summarize, but we're running a little over. So if you can give us just a couple more minutes. On our next slide, please. There is, of course, a lot you can do, and Julie did a lot of that. The first is just being here, increasing your awareness about what you can do, what you need to do. So next slide, please. We are going to skip questions. I know we do have one question. After I do the closing, if we want to answer that one question, we will come back to that. So next slide, please. Like Julie said, your local area agency on aging can provide you information and support for caregivers, including respite, powerful tools for caregiver workshop that you can participate in. The ICOA website has a self-paced training on how caregivers can make sure that they take care of themselves as well as others. And I'll post that on our website as well when we get there. David, can you go to the next slide, please?
These slides have quit moving.
They have quit. Well, that must mean we're out of time. So I will just say very quickly, thank you to David for running our slideshow. Thank you, obviously, for Julie to bring us the wealth of her experience and information on how to have those sometimes difficult conversations with caregivers. Remember, you can download the guide that has a lot of information in it as well, and Julie's slides from either your resources panel here or our website. And with that, I will thank you all for staying a few minutes after. We appreciate your time, and we hope that you can help us all do your best to stay falls-free in ID. Thank you, everybody. Have a wonderful day.
Erin, I think your question in the chat